Good afternoon, everyone. Today we sadly recorded another 2 COVID-related deaths in Northern Ireland, and once again I want to convey my deepest sympathies to the families and friends of those who have died. It was a year ago this week that we announced the first confirmed case of coronavirus in Northern Ireland. We've been through a lot together over the past 12 months, and the pandemic has left lasting scars on families and communities. And while we can see better times ahead, we still need to maintain our efforts to stop COVID-19 spreading. This isn't over yet. This virus thrives on complacency, it seizes on carelessness, and it multiplies when we let our guard down. I firmly believe that cautious optimism is the correct approach to take right now, particularly so given the risk of COVID variants spreading and developing. There is hope, but let us not lose sight of that. Today we see yet more evidence of the progress of our vaccination programme. As of yesterday evening, we had administered more than 509,000 vaccines. There are countries many times larger in population terms than Northern Ireland that are nowhere near administering 500,000 jabs. That's a huge achievement, and again I want to thank all our vaccinators, our organisers and our volunteers across trusts and primary care for reaching this milestone. But we still have much road left to travel, so now is not the time to turn back or to sit down mid-journey. So let's each of us complete that journey, and let's complete it together, so that each of us who have had patiently to wait for our turn in the vaccination programme, that time will come. But Northern Ireland is pushing on. Every jab is another step forward and another step towards a better future. We are all aware that schools have been in the headline this week. And let me make it clear. As the father of 2 primary school aged children, I want to see our schools fully opened as much as anyone else. But I want to see that happen when it's safe and sensible to do so. Many of the details around last week's executive meeting have already been reported, and so people are aware that there were 2 options presented. One to open all schools from the 8th of March, and another one to permit a phased return from the 8th of March, with the Department of Education deciding on what cohorts they would prioritise. The medical and scientific advice was to act with caution and to carefully assess and monitor the impact of reopening in order to minimise the risk of RT once again exceeding 1. And whilst I note that England have decided to open all schools from March the 8th, it is also important to recognise that Scotland, Wales and the Republic of Ireland have all decided on something else. And we should not apologise for taking our own decisions. Otherwise, what is the point of devolution? The gradual step-by-step approach agreed collectively by the executive, I believe, was the correct one. Let's remember what's at stake here. We can't jump the gun. We must not stumble when we can see the finishing line so close in the distance. I don't want to be back here in the spring or early summer commentating on another COVID surge, or on our hospitals filling up, or our staff being exhausted and in despair. I don't want to have to propose yet further restrictions at that point. So let's not get ahead of ourselves, because there is always a danger when we discuss any easing of restrictions that some people will jump to the conclusion that the danger has passed, that this is over or nearly over, because we are not there yet. Easing our way out of lockdown was never going to be easy or straightforward. It's finely balanced and hugely difficult decisions that are required. I'd rather be too cautious than reckless, especially when we know the damage and heartache that this virus can bring. I don't want to have a look a grieving family or a devastated health worker in the eye and say sorry because we opened up too quickly. We need a sustainable way out of this and durable foundations for the future. The pandemic has taught us that we need to care for our health service much better than we have. It was already in a bad way well before the ravages of the past 12 months. Getting it back up and running properly, with the COVID threat still lurking, will be a long-term undertaking, and there will be no overnight or easy fixes. This task is made considerably more difficult in the context of yet another single year and already badly stretched budget. We have appalling waiting lists and well-documented pressures in social care and in mental health. The past year has rightly been described as the biggest challenge of our lifetimes. And there is another one waiting for us. Rebuilding our health service, rebuilding our economy and rebuilding our society, and making them better for all our citizens. We can do it, but it will take a unity of purpose, a unity of message, and a collective determination. And it will need everyone pulling and working in the same direction. I'll now hand over to the Chief Medical Officer for this week's update.
Thank you, Minister. Good afternoon, everyone. Sadly, as the Minister has outlined, we're reporting further deaths today, and I want to take this opportunity to extend my sincere and deepest condolences to the family and friends of those who are now grieving. It's almost a year today since we had our first case of coronavirus in Northern Ireland. We have come a long way in that year. We have sacrificed much, and we have seen many scientific breakthroughs, the benefits of which we are seeing realised day and daily. And that will help lead the way as we take cautious steps to recovery. The cautious approach to easing restrictions outlined by the Minister is well grounded. It reflects the data about where we are with the virus right now, and it reflects the reality of the continuing threat from COVID-19 and our experience over the last 12 months. Today we have reached a very important milestone. Over 500,000 doses of the vaccine administered. And I want to thank everyone involved in that programme for their efforts. And I want to thank everyone who has come forward to take up the offer of the vaccine. The rollout of the vaccine is ahead of schedule, and it is a significant step forward in our fight against the virus. The vaccine provides hope, and it provides protection to many. And alongside testing and contact tracing and the well-rehearsed public health advice and interventions will be crucial as we unlock the restrictions and to prevent further waves. I'm now going to show some slides to show the infection rates in Northern Ireland and to give the overall picture of the pandemic here at this time. The first slide shows the 7-day rolling average of new positive cases. And as we can see, this has not changed significantly in the last week. The rate of decline has slowed, with an indication that the previous rate of decline may now have plateaued and levelled out. But as I say, it is early days and we need to keep that under further consideration. Although the case numbers have fallen significantly since the start of this year, we need to bear in mind that currently we are seeing just under 300 new cases reported each day. This compares with the situation back in the summer when case numbers were in single figures. We continue to see positive signs of the impact both of the steps that the population is taking and of the vaccine programme, and we're seeing a continued reduction in the number of cases in those over 60 years of age. The next slide shows the cases per 100,000 by local government district. Now, although most of the local government districts have experienced a decline over the last week, there have been some increases in Mid and East Antrim and Ards and North Down. Mid-Ulster continues to have the highest prevalence. However, even in Mid-Ulster, we are seeing a decline, and also a decline in Armagh City, Banbridge and Craigavon, again reflecting the efforts of the population and the working between our public health agency, local government and other agencies. Could we have the next slide, please? Next slide. This slide shows the case rates per 100,000 across the common travel area. And as we can see, there has been a convergence of the numbers of cases per 100,000 of the population. So the difference between the five nations has decreased and is less marked than previously. There does, however, appear to be a levelling off in the downward trend in recent days. Next slide, please. This slide demonstrates the data from the Office of National Statistics from the Coronavirus Infection Survey. This week, the week ending the 12th of February, estimated that just under 1% of the population in Northern Ireland had COVID-19. 0.97%, or around 1 in 105 people. Northern Ireland, as you can see from this slide, continues to have the highest modelled prevalence of COVID-19 of the 4 UK countries. And of the next slide, please. This slide shows the 7-day rolling average of new positive hospital admissions. The rate of infection in the daily number of new COVID hospital admissions has continued to decrease, but the rate of that decrease, you can see from the slide, has declined and has also levelled off, again demonstrating that we still are at a precarious stage of the epidemic at this time, but things generally heading in the right direction. And the next slide. This slide demonstrates the number of COVID-positive patients who are currently in hospital. Again, the number is falling, although this is at a slower rate than was experienced recently. And as we all know, unfortunately, the number of people in hospital with COVID will remain high for quite some time. And it is important to note that it remains higher than the peak that we saw last spring. This slide demonstrates the current trends in people in intensive care with COVID-19. And again, we can see that the numbers have fallen less markedly, as we know the length of stay of such patients is often lengthy, and the number of people with COVID in our intensive care units is likely to remain high for some time. And finally, we have on this slide the number of COVID-19 hospital deaths. This is hospital deaths only. And what we're seeing here is a very significant decline in deaths from COVID. That is very welcome news. And that is down to two things. It's as a consequence of the measures we are taking, all of us, to protect ourselves and others and reduce and break chains of transmission. But it is increasingly an impact of the vaccination programme, which is reducing cases in the community and protecting those most at risk of severe disease and those most at risk of death. So, in summary, infections have fallen significantly as a result of the efforts of everyone, and undoubtedly this has saved lives. And while there is a suggestion that the numbers of new cases may be plateauing, we are most certainly in a better position than we were earlier in the year. The infection rates at present, however, are sitting stubbornly at around 300 each week. And as the Minister said, as spring comes, we expect a seasonal benefit in relation to the transmission of COVID. And it is right that we are hopeful. And it is as a population, it is right that we begin to look forward with optimism to the day when we too might emerge from the restrictions that we have in place, and increasingly the vaccination programme does much of the heavy lifting. We will slowly but surely emerge from the restrictions that are necessary at this time, and we are moving, as the Minister said, forward cautiously, but we can do so with a significant degree of optimism.
Okay, thank you, Michael. I'll now ask for an update from Dr. Patricia Donnelly, our head of our vaccine programme.
Thank you very much, Minister. As the Minister has stated, we have passed a landmark today in the vaccination programme. We remain firmly ahead of our original schedule and will continue to push forward as quickly as supplies allow us to do so. The latest running total shows 509,000 vaccines administered. Of these, 478,000 have been first doses and 31,000 have been second doses. The numbers divide equally between GP practices and the 7 trust vaccination centres, and that underlines the value of our twin-track partnership approach. We obviously want to not just maintain but build on this progress that we've made to date. As ever, the speed of the rollout will depend on the manufacture and supply of vaccines. As scheduled, supplies of AstraZeneca vaccine to GPs have been more of a stream than a river in the last few weeks, but we expect that the quantities to increase significantly next month. This allows us to extend the vaccination to further groups of people. I can reassure our GP colleagues that we appreciate the important work that they do and understand their frustration to date as they await these precious vaccine supplies. Today, we're publishing the latest indicators of our progress of first doses, and this includes 95% of over 80-year-olds, 90% of 75 to 79-year-olds, 84% of the 70 to 74-year-olds, 69 of the 65 to 69-year-olds. And the clinically extremely vulnerable and vulnerable groups, 39% of them have already been vaccinated, and that's on top of those patients who've already been covered through the older age group vaccination programme. We're also continuing to work with to vaccinate all adult carers. We've worked in partnership with the carers organisations who've given us valuable advice and guidance in the planning and delivery of the programme. And I wish to take the opportunity today to restate the JCVI guidance on the definition of a main carer. And that's an individual who gives substantial and ongoing care to an elderly or disabled person. This represents regular substantial report and not just shopping or errands. In our further detailed discussions with Carers Group this week, we've received very positive feedback from carers about their access to the vaccination programme. Many carers have already been vaccinated because of their older age, but in our recent launch, carers have come forward in large numbers, and any abuse of the system that's been reported by those who are ineligible is very much a minority pursuit, but it is of concern to the carers organisations. There's been heavy booking of available slots in the vaccination centres for the coming weeks. But while we may be close to being fully booked for this period, we're taking a flexible approach to ensure more people are reached during this period. We believe some carers who've not yet come forward or not yet able to book, the Trust will work with Trust care coordinators and the carers organisations to get them booked in. Carers who are already known to their GPs are also continuing to be called forward by their GPs for vaccination. These are usually those who are called forward as part of the winter flu vaccination programme. Alongside this targeted approach for carers, I can announce that there will be further vaccination appointments made available in the large centres in the next few days. These slots will be mainly for people 65 plus age groups, for those receiving a shielding letter who are clinically extremely vulnerable to the virus. And if you're in those groups, please get yourself booked in. And in line with the latest JCVI advice and guidance, those with a learning disability will be called forward by GPs for vaccination if they haven't already been vaccinated through the trusts. And we know that many have. In conclusion, I would appeal to people to use the booking system responsibly. Please book online if you possibly can. It eases the pressure on the telephone booking system. Please only book a vaccine slot if you're eligible. Do not make multiple bookings. If you get a booking, please keep your appointment. Be patient, we will get to you. We have big plans for the further acceleration of the programme. Watch this space.
Okay, thank you, Patricia. Mark Mallet, UTV. Hi, Mark.
Yes, good afternoon. Minister, you draw the comparison with what is happening in other parts of the UK surrounding schools, and indeed much has been made of the decision to let pupils in England return to the classroom. I know in your opening remarks you said you didn't want to be back here in the spring or early summer. Do you believe the decision taken by the Prime Minister is the wrong one in letting children return to school there? And indeed, is the scientific data, along with progress in the vaccination programme and testing regime there, so vastly different to what we have here?
Mark, one thing I have never done from this podium is compare us to anywhere else or second guess what decisions have been made by other administrations. My focus is on the delivery of our healthcare service, of the vaccination programme and of the safe return to the schools here in Northern Ireland. So I'll not be commenting on anybody else's actions, nor would I expect any other devolved administration, Prime Minister or politician to be commenting on ours.
Right, and on the vaccination programme, 500 million doses have now been administered, but an adult population of 1.5 million in Northern Ireland, each requiring 2 doses. That's 3 million doses needing to be administered. We're some way off in actually achieving a good and final result of the vaccination programme. Is that concerning, given the arrival of the likes of the South African variants and the thought that the vaccine may not work against those variants?
Mark, in no way would I want to downplay the achievement that our vaccination programme is. Of the eligible population of both these vaccines, which are eligible for the adult population, the average population in Northern Ireland will be 1.4 million. So we're well over 1/3 of our population have received the first vaccine, and we're already seeing from the studies that the protection that brings, both from the vaccine but also in transmissibility as well. So let's not underestimate the large achievement, the fantastic achievement that our vaccine programme has been brought about and actually delivered under the care and guidance of Patricia Donnelly, and bringing that forward in a very short space of time. So it's something that I'm proud of. I think it's something that all of Northern Ireland should be proud of. When we look at vaccination programmes across many countries, especially those in the Western world, who would be envious of having vaccinated 500,000 people in their population alone, never mind the extent and the size of the population that we have here in Northern Ireland. In regards to the other variants that are known and are of concern at this minute in time, the ongoing work goes on in regards to the vaccines that are available and the effectiveness that they will have. But it's also, I think, to the credit of the scientists and of the pharmacy companies that are behind these vaccines, that they're already working on the next phase that will combat not just the variants that we know about, but will look to potentially challenge the variants that are yet to come as well. So our vaccine programme in Northern Ireland is a great achievement, and it's something I would encourage everyone to be proud of. Conor Spackman, BBC.
Good afternoon.
Conor.
Good afternoon, Minister. Good afternoon, Minister. The Prime Minister said on Monday, and his words were echoed by Chris Whitty, that once this lockdown is lifted, that as a society, we've got to be realistic and accept that there will be more infections, hospitalisations, very sadly, more deaths. In the Prime Minister's words, just as there are every year with flu. Do you agree with the Prime Minister's sentiments?
Conor, this virus isn't going away. It's not going anywhere. The difference that will be is our reactions to each other and how the virus spreads among people as well. So our actions will depend on how many people see infections, how many people lose their lives. I would agree with the Prime Minister that I sincerely want this lockdown and this reset of further restriction to be our last one. And we can do that. We can do that together by making sure that we come out of this set sensibly and at a pace that manages where we are in Northern Ireland in regards to the spread of the virus, but also in supporting our health service as well. So this is about doing what is right, doing it at the right speed, so that we can ensure that we don't have to come back to where we are now.
But Minister, the Prime Minister made a very specific and I suggest deliberate comparison with flu in terms of how society's mentality addresses COVID in the future. So on that basis, do you have anything specifically to say about what he said, comparing COVID to flu in that sense?
Well, I think we shouldn't underestimate the ability for COVID to mutate and the variants that we have seen as well, and the seriousness that it does bring. I wouldn't want to draw direct comparisons between two viruses which have very different foundations. The effect on how we manage and how we react to both will be similar. We both know, or we know that both viruses can be managed, can be controlled by social distancing, good hand hygiene, good respiratory hygiene, the wearing of face coverings, but also can be managed and the population supported by an active and wide-ranging vaccine programme. And that's one thing I think we need to concentrate on now, so that we truly get the maximum effect and benefit out of the vaccine programme that we have in place. Michael, do you want to pick up on the specifics?
Thank you, Minister, and thank you, Conor, for a very important question. I think that, as we've all said for some considerable time, this virus is not going anywhere. This virus will be endemic. It will be one of the circulating viruses, respiratory viruses, that we will continue to live with. I think it's important that we also recognise that we cannot eliminate the virus. It's important to recognise, nor can we continue to live with the restrictions indefinitely that are currently in place. And indeed, there is no requirement to live with those restrictions any longer than is absolutely necessary. And as the Minister has said, the one way to avoid the need for any walking back is to proceed cautiously. So careful, cautious steps informed by the data, one step at a time, assessing the impact before we make the next step. I think that, I was reflecting as I was standing here, to think that a year ago we would have been standing here with a vaccine, and we have vaccinated over a third of the population in Northern Ireland, that we now have effective treatments for COVID-19. I don't think I would have believed that. The fact that we are and continuing to roll out the vaccine at pace, that we do have effective and better treatments, and we will have more effective treatments, does mean that increasingly we will be able to manage COVID much more effectively. I think it does mean that we will see pockets of the infection in the months ahead. It does mean that we may see some increase in cases, perhaps over the autumn and winter. I think it does mean that we need to reflect on having some of the measures around wearing face coverings, some of the choices we make about contacts and things that matter to us and that are important to us, and some of the steps that we've been taking around hand sanitizer. I mean, if we look back on this winter, the impact that it has not had only on COVID, we have had no outbreaks of seasonal flu, which is a huge pressure on the health service every year. We've had no outbreaks of RSV virus in children, and we have not had significant outbreaks in our hospitals of the winter vomiting bug. So there have been adaptations to how we all live our lives, and some of those will probably remain, but only for as long as is absolutely possible. The SARS-CoV-2 virus is not flu. We know a lot about flu. We're still learning about SARS-CoV-2. So I think, as the Minister said, they are not the same virus. I do hope that we will get to a point with vaccinations, better treatments, that how we respond to SARS-CoV-2 will be more like how we respond to seasonal flu each year.
Okay. David Young, PA.
Hello, it's Michael McHugh here. Actually,
so apologies, Michael.
Minister, I know we're interchangeable sometimes. Apologies. Just a question for Dr. McBride, and following up on what he was saying to Conor there. I think you said recently that if there was another wave of COVID, it could be the worst yet. In terms of the psychology of this, are you concerned that if there is what's the term, a rush out of lockdown, that would encourage people to think that the pandemic is over and they can return to normal?
I think it's very important, Michael, that we are all reflect on our language at this point in time. I think we need to reflect on people are very tired, people are fatigued. The restrictions have taken a huge toll on people's livelihoods and people's lives that have been lost, people who are bereaved, who we're talking about today, but also on people's mental health and well-being. So the population out there needs to believe that there is hope, that there is a way through this. There is hope, and there is much cause for optimism. But that needs to be tempered with the realism that we will be living with this virus, and we will be living with this virus for many, many years to come. And as vaccines get better, maybe they need to have booster doses in future years against new variants of the virus, and as treatments get more effective, then this, in a hopefully not too distant a future, will be more like how we live each year with other respiratory viruses. We're not just there yet, but we've made immense progress. If you think of the progress we have made in the last year, medical science and medicine has mapped a way out of this for us. And I am optimistic that continued advances in medicine and science will continue to make significant progress so that we can all resume more of a degree of normality. It's not just yet, and I think it's important, as the Minister said, that we are cautious, that we are careful, but equally that we point to people that there is hope and much cause for optimism.
Thank you. And Minister, just a question for yourself, and I know you've talked about this issue before, but if the Prime Minister is thinking about COVID passports for entry to shops and the like, do you think we should be doing the same here?
It's not something that has been considered or discussed either in any detail within my department or the executive as well. I would rather see people come forward and take the vaccine for the benefits and the health benefits that it brings to them as individuals, and also the support that it gives to society in general as well, rather than it being used as a passport to access either a service or a location as well. I know there is discussions going on within UK government in regards to what a vaccination certificate may bring and what it may mean in regards to international travel, or how other countries themselves actually look for that for UK citizens coming into their jurisdictions. But it's not something that has been widely discussed in any great detail, either within the department or the executive. Tara McLaughlin, Cool FM.
Yes, good afternoon. First question for Patricia, please. Given the numbers that you've given there and the breakdown of the vaccines uptake is largely good, or are you concerned about any groups that aren't coming forward or that haven't come forward to date?
Thank you very much. A really important question. I think we've been worried about younger people, and we've been particularly worried about younger women. And we know that's the case both within the health service, and we know that's the case between the carer workforce out in both in care homes and in the domiciliary care workforce. So we know some of the worries that they've had have been about the impact on fertility, etc. And we've been working with a number of individuals, and I think there'll be some further advice from the Royal College of Obstetrics and Gynaecology about the safety of the vaccine for individuals. And I think that's an important message for those young people. Of course, there's other groups that are harder to reach. We've been talking this morning about the homeless, for example, and others. So we will have a different strategy according to the group and according to how we need to influence them and when we need to call them forward.
Tara, we are aware of organisations going round and leafleting to try and detract from people actually taking the COVID vaccination in regards to spreading false information. The World Health Organization has actually commented on those leaflets and has actually said they will cost lives. So I'll make a public call for those organisations who are distributing those very dangerous leaflets and those individuals to cease and desist, because if the World Health Organization has assessed their information and the information that they are now distributing throughout Northern Ireland, and their assessment is it will cost lives, I'll ask them to consider what their actions and the effect they will have.
Dr. McBride, a question for yourself about one specific area of our community. We've been contacted by people who are shielding and they're having issues with employers asking them to return to work after maybe the first dose of the vaccine. Can you clarify the official shielding advice in Northern Ireland?
Yes, the official position has not changed from the advice that was issued prior to Christmas. There were additional shielding letters issued by both trusts and by general practice to those individuals who are clinically extremely vulnerable. We don't use the term shielding any longer because we revised that cohort of individuals. We added some in and to that list. And if individuals do not have a current letter, they can use their previous letter, which doesn't mean that they are eligible for statutory sick pay, etc. And if they have any difficulties with that, if they look on the NI Direct website, there is advice and support available to them.
Okay, thanks, Tara. Okay, folks.